Hi, I'm Stacey Hoppus. Joining me today is Stephen Civitelli, the Director of Public Health here in Wallingford. Steve, thank you so much for being here today.
Thank you for having me.
Well, as we know, the COVID-19 pandemic is here, and you guys are doing as much as you can to help the town get through this. So I just thank you for coming on and talking to me about this today. I think, why don't we start with the overall numbers here in Wallingford and what we're looking at in the next couple days, couple weeks.
Okay, so as of right now, total cases going back to March roughly for the town is around 518 positive cases. But I often remind people that doesn't mean we have 518 infectious individuals in the community.
Right.
So that's where our contact tracing comes in. As of right now, we're actively monitoring 3 individuals who would be considered infectious. So you can see the disparity there is much greater, far less than what we were seeing back in March and April.
Absolutely.
We monitor those individuals for 10 days through our contact tracing system.
Okay.
So at that point, that's where we are in terms of total numbers. Of the 518, we had a roughly 50-50 split between long-term care facilities and community cases.
Okay.
So we try and distinguish between those two as well to let people know where exactly the cases are taking place as well.
Right, if they're coming from senior housing or convalescent homes, or if it's actual communities and families in the...
Yeah, exactly. So as of right now, for the month of August, we have 11 cases, 10 of which are in the community and 1 which are in long-term care facilities.
Okay. And then as far as like town hall goes, what is open right now? I know people are aware they can go on the town website and find out information about where you can go in hours, but how is the town hall looking?
So as of right now, town hall was reopened to the public July 20th, I believe. And since then, we've installed partitions, barriers between the staff and the public. We've also installed signage, required mask wearing when entering the building, signs and symptoms, to preferably not come in the building if you're having any of COVID-like symptoms.
Right.
We're also installed social distancing floor signage to separate people in high traffic areas. We have 6 hand sanitizers available throughout the building, touchless units in high traffic areas.
Nice.
So we tried to do some mitigation methods to try and protect the staff and the public. We've also limited occupancy in certain offices that were smaller. For example, the tax office, we limited to 2 people inside while conducting business.
So people can now go in and pay your taxes, pay your utility bills, and obviously there's still the payment drop-off slots and things like that.
Correct. The payment drop-off box is still available, but if you need to come inside the building for any reason, when you enter the building, you'll see the social distancing signs, the masks being required. Right. And again, because there's a partition between the staff and the public, it provides another layer of protection.
Absolutely. I was in the town clerk and down in planning and zoning the other day, and there's definitely all of that there.
We've done a considerable amount to protect staff and public when entering the building.
Okay. And then how about library and senior center? I know that they are open, but what about the senior center?
So it's my understanding the senior center is slated to reopen right after Labor Day on September 8th.
Okay.
According to the Connecticut reopen guidance through Department of Economic Development, September 1st, senior centers are permitted to reopen again with certain guidelines in place. I did a walk through our senior center recently, and you'll see a lot of the steps that were taken at Town Hall were also taken at the senior center, in addition to some other things. But my understanding, September 8th for the senior center right now.
And I know they're doing a lot of virtual programs. They're doing a lot of their hikes and kayak trips and things like that. So they're still trying to be as active as possible with the community. So that's good.
That's correct.
And then the library, they're limited capacity, but they are open?
That is correct. At this point, the library has just limited their capacity, limiting people's exposure within the community by limiting those numbers. Same thing will take place at the senior center as well.
Okay.
So dependent on where we are in our community and our county-based levels, will probably dictate how many people we allow in the building. So it'll be an algorithm that we use. And
depending on which room they're using for each activity that they're offering.
Correct. Capacities have been set for certain rooms, depending on their size. The activity room, some of the equipment has been moved to provide more than 6 feet of distance between occupants. So there's a lot of things that have been put in place to protect the occupants when they're in the building.
Wonderful. And then like restaurants, salons, how is all of that going?
So as of right now, the Director of Health is designated as the enforcement authority for all the Connecticut reopen guidance as it pertains to restaurants, salons, daycares, all the facilities that we would normally license.
Yeah.
We enforce the mask requirements. So we've gotten quite a bit of mask complaints over the last several months. But the restaurant operators have been doing very well.
Okay.
When we receive a complaint, we address it like we would any other at this point. So I think to date so far, we've had close to 100 complaints that we've responded to.
Oh, wow.
And more times than not, the operators respond well to our requests.
And if someone in town does see something and they have a complaint or they see an issue, they contact your office, correct?
Correct. They could either give me a call at our office, 203-294-2065,
Okay.
or on the town website. All of our email addresses are available.
Right, you can go into government to the health department
Correct.
section and everything's listed there.
Correct.
And we'll put some of it on the screen as well.
Thank you.
Okay, and now the big question that everybody has is schools. I don't want to get too much into everything because I know things are changing daily, but what can we look forward to for the schools?
I think the big thing from our aspect was monitoring county and community cases to see
Right.
where we are, where the background levels are. And that's something that we're going to be monitoring quite a bit.
Right.
At this point in time, we're in what is considered a low risk category. So they have low, moderate, and high
Right.
when you're looking at community levels and county levels.
Right.
And that'll determine how the schools perform in terms of if it's a hybrid model, if it's fully online. So that has been set by State Department of Education.
Right.
We provide input in terms of some of the recommendations we have for whether it's distancing, masking. We've been working with the Board of Ed quite a bit.
Right.
More recently, I did a presentation with the Board of Education on our community case numbers to inform them
Yep.
prior to them making their decision as to how to approach return to school. So at this point, there's quite a bit that is involved with the schools, but we've been pretty diligent in working on those items.
Right, and so if people aren't aware, you have been on the town council meetings and you've been on the Board of Ed meetings lately. So if anyone wants to go back and view any of those, they are on the Board of Ed website and they're also on our YouTube station as well.
Correct, and
Okay.
moving forward, it's my understanding having the COVID-19 update is a standing agenda item on the council.
Okay.
So every 2 weeks or whenever there's a council meeting, I'll be there, a representative from our office, giving a general update
Okay.
to the community. We're also in process of putting together a PowerPoint presentation that we're going to upload weekly or bi-weekly to the town website, in addition to the other information we have available from CDC. So it'll give CDC guidance as well as the local numbers, so
Right.
people have a general idea of where we are.
Yeah.
What I've noticed over time is that you have influxes. So this past week, we've only had one case. 2 weeks ago, we had 7 cases in a week. So you try and take an average of multiple weeks over time.
Right.
You hear a lot about 7-day rolling averages when you talk about statistical analysis related to cases. So that's something that we're looking at.
Right.
While the state looks at every 7 days, I could promise you we're looking every day
Okay.
to see where we are.
Absolutely.
That's what we do.
All right, and for people that are looking for CDC recommendations, requirements, protocols, all of that is on our website as well.
Correct. There's an FAQ question area. There's how to protect yourself and others, how to protect yourself if you become sick.
Okay.
Those are all available on the town website.
All right, and that's in the news and information section, and then there's also some on your guys' section of the health department section of the website as well.
Correct.
Okay. Now, and we can go there to get all of our updates and everything. We talked about enforcement issues and complaints, but what else is very important for the community to realize that what they should be doing going forward? Continue wearing your masks. What would you say is just very important for the community to realize so that we don't have a resurgence?
So if you look at all the recommendations in the governor's orders, the Connecticut Reopen Guidance documents, they're all a layered approach to try and combat prevalence of the illness.
Right.
So if you're wearing your mask, if you're providing 6 feet of distance between each other, 6 feet of social distancing actually, as it was described to me initially, mimics herd immunity, in that if the virus doesn't have the ability to actually be transmitted to somebody because of distance, then that way it almost can't spread any further. So that's where the whole social distancing piece came in. So if you keep your social distance, you're wearing your masks, you're limiting your exposure in the community, you're not having large gatherings.
Right. What are the gathering recommendations right now?
They change frequently. As of right now, for indoor gatherings, it's a maximum of 25 people for private gatherings.
Okay.
It's allowed to have, I believe, per governor's orders, 100 for outdoor private gatherings. There's other sector guidance that permits larger gatherings for, say, Oakdale.
Okay.
Or other organized events. So there's different guidance levels for certain, depending on what organization you are.
Okay. All right. And then have you heard of anything about the vaccines? I know that there's vaccine information on the news everywhere, but have you heard of anything directed towards us?
So at this point, it's my understanding we have frequent CDC calls to get updates on those things, and it's my understanding that there's 5 vaccines in process that are moving along quite well, phase 2, phase 3 trials.
Okay.
We're being told to look at quarter 2 for next year, which would probably be, April, May, June, potentially for public use.
Right.
The question becomes what does that vaccine look like? How is it administered? How is it stored? What's the efficacy of it? We don't know a lot of those answers yet. As time goes on, our goal now is to try and be prepared to administer it if indeed something is available. So we have plans for mass vaccination in town, which we've had for years.
Right.
So we're freshening those up to make sure that we're ready in case a vaccine becomes available.
Great. And one last question that I didn't talk about with the school system. How is it looking for sports? Are we pushing sports forward? Do we have any idea?
I think at this point there are a lot of questions around sports, rightfully so. There's a lot of different entities that are involved. You have CIAC, you have the State Department of Public Health, you have us, you have the Superintendent's Office for the Board of Ed. A lot of times we're at this point, we're waiting for guidance from the state to see what their position's going to be. There's low, moderate, and high risk sports. We've had baseball operating over the summer as considered a low-risk sport, not a lot of social interaction one-on-one.
Right. It's not like football or basketball.
Correct. Right. So we're trying to see what exactly that'll look like and what the recommendations will be. So at this point, we'll wait and see what kind of recommendations come from the state.
Fantastic. Well, thank you so much for coming on today. I know it's a lot of information, but I think it's very important for the town to see a face and to get the information that they're looking for.
I appreciate it.
So thank you so much.
Thank you.
And once again, I'm Stacy Hoppus, and I'll see you around town.